So, you know, men are afraid of surgery and afraid of having pain, right? And so one of the questions that I wonder how you handle is when they ask you, what is the recovery after surgery and how do you handle pain and discomfort? Yeah.
And I think a lot of our job is to help kind of guide that patient through that process. Personally, in terms of what I recommend to our patients, I use a lot of ice packs. We have the patients use a lot of scrotal supportive underwear, so things like jock straps to help keep things elevated. And usually I'm recommending medications like Advil, Motrin, Tylenol with narcotic pain medication available in the event that that patient will require it. Most patients, in my experience, by 2 weeks are able to start identifying and able to start pumping. And usually it's by about the 4-week mark where patients are able to use it for sexual activity and to be happy with a partner. Is that different from what you?
No, it's very similar, very similar. I find that most of the pain is the first night. So we treat that with bed rest, ice. We make narcotics available for the first night, but we like the patients to take anti-inflammatories like Motrin or Advil, usually in large doses, 800 milligrams, 3 times a day, nonstop. And then if needed, they'll dovetail with the stronger medication. We find that it's good to get the patient encouraged to inflate, deflate early. And some of our patients will start as early as 3 days after the surgery, but they'll still have discomfort and pain for the next 2 to 4 weeks when inflating. And sexual activity usually between the 3rd and 4th week. So it's very similar.
Yeah, I think the important thing always to hammer home is that they're not going to walk out and go have sex that night. No. That it's going to be about a month before they're going to be comfortable again.
And then the other thing that I tell them is it's going to take about 2 to 3 months before you're no longer aware that there is an implant there. And they find it hard to believe that at some point you're not going to feel anything. Right. You're not going to feel that something is in there.
Yeah.